Hello everyone, welcome to my presentation on response to intervention. Because response to intervention is a process that affects the regular classroom specialists and special ed teachers, it's imperative that you leave this course understanding the intricacies of how it works. In too many districts, it has morphed into just another remedial program. That's not, and I emphasize not, how it was designed or how it should be implemented. Here's my definition for you, for your vocabulary in your own words. RTI is a three-tiered process, note I underline process, that includes screening, research-based core instruction, research-based interventions with progress monitoring meant to catch students up to their grade level peers. It is also an alternative to identifying students as learning disabled, or LD. So it really runs the whole gamut of practitioners in a school building. It is coming to the forefront, and if you are applying for a job, whether it's a regular job, a specialist job, or a special ed job, it will behoove you to understand and talk intelligently about response to intervention. After we get through this presentation, you should be able to do that. I want to begin with a slide that comes from Fisher and Fry's chapter. Traditionally, the old paradigm, that one that I experienced through most of my career in the classroom, teachers followed was that they kept teaching in time constant, and what varied was student learning. So you had ed plans that you used every year and regurgitated them. What should be happening is in the second image, where teaching and time vary. We call that differentiated instruction, so that learning remains constant. In your DEJs, you can tell me if you believe that this could be reality, or whether it's just another pipe dream. This too shall pass. This next slide is going to show you what I consider dramatic results of not only research-based core instruction, which is classroom instruction, but how it affects at-risk students who receive research-based intervention. This first graph from the research study shows the progress in reading of low-risk students who are identified in the first grade. You can see that after 4 years, they are reading on a fifth-year, 2-month level. This second graph shows kids that were identified in the first grade as being high risk on early screening. This is the progress they made without any research-based core or research-based interventions. You can see 2.5 years to 2 years, 5 months. The kids who are not at risk are almost double. So we are talking here over 2 years and a 4-year span that they have fallen behind. The next line is what these at-risk kids did with research-based core, but without any extra instructional intervention. Even that is over a half year better than the kids that got nothing. This next one is the graph that really impresses me from this research study. It is with research-based core and extra instructional intervention. These kids are at 4 years, 9 months, and almost caught up to the kids that were low risk at screening. I think that says it all. The next slide shows you where we are, and still are in many districts. In our method for identifying whether a student has a learning disability, it's commonly referred to as the IQ achievement discrepancy model, and I think it's worth mentioning in your double entry journal. The way it works is that the school psychologist gave a failing student an IQ test and an achievement test, let's say in reading comprehension. If the student was 2 or more years behind where he should be, then boom, he was classified LD. Just these 2 assessments. Typically for his life in public school. So if a 4th grade student with an average IQ between 85 and 115, according to this chart here, this graph, was reading at a 2nd grade level or below, he was designated as learning disabled. In your DEJ, write about what's wrong with this method and why it was called wait to fail. Most response to intervention models look like this sample 3-tiered illustrations. Some districts use a 4 or 5-tiered model, but to make it simple, we will use this model in this course. The foundation of response to intervention is that all students receive research-based core instruction in the regular classroom. That would be Tier 1. I would check out John Hattie's Visible Learning, and you can Google that to see which strategies that he found would increase achievement the most. And I would use those. He found the practices that had the largest increase in student achievement, so the largest effect size, they call that. As a school identifies struggling students who are not responding to whole class instruction with in-class interventions, a student moves into the second level where approximately 5 to 10% of students can be found, or that's how many should be found. In this tier, specialists normally provide intervention in addition to regular research-based instruction in the classroom. The third tier is for those students who do not make adequate progress at Tier 2 and usually entails a referral to special education where individual interventions can be implemented much more intensely. So through each tier, the intervention intensities increase. Theoretically, this last tier should only have 1 to 5% of school students. Doug Fisher, one of the authors of the chapter that we read for this module, stated, and I agree, that if you have too many kids in Tier 3, you probably have a Tier 1 problem. This slide has a flow chart that represents the movement of students, and I'm using it just to show you that the way it should work, how students flow in and out. You'll notice that students can move back down if they are responsive to intervention based on progress monitoring, or PM. There are no life sentences. An 8-week period, many people ask, how long should we do an intervention before we should try something else? An 8-week period with twice weekly progress monitoring is the recommended procedure. In this slide, I've listed the steps of RTI once it has been determined that a student is falling behind. This process, and I'm not going to go through it because it's outlined in much more detail in the Salvia et al. Chapter. You can see that there are a couple of vocabulary in your own words terms here, and those can be found in the chapter 12 in Salvia et al., which is one of your readings. This is a progress monitoring chart with progress listed and compared to a trend line, or where the student should be in order to catch up to peers. This is a crucial part of RTI that is often missing in many district programs. We are trying to catch the student up, not slow them down. In your DEJ, you should mention one of the sample students in our readings, Kim and Salvia et al., Abby and Fisher and Fry, or Jinsu and Cohen and Spencer, and talk about how that process worked. Curriculum-based measurement is a way to measure student progress that coincides with the curriculum you are teaching. CBMs are, again, this is more vocabulary, CBMs are short, timed assessments that are sensitive to small gains in achievement and are often called probes. Because they are quick, ranging from 1 minute to 5 minutes, they can be given often. And this last slide describes 3 characteristics of an RTI program that must be present. Measurement sufficiency, which means you need to have the assessment tools available to monitor progress accurately. Instructional adequacy means are the teachers using effective core instruction and research-based interventions to ensure growth? And finally, are there rules for making decisions? How long are we going to keep doing this intervention, and when are we going to make how are we going to make a decision, and when are we going to make a decision where the student either goes up a tier or back to a regular classroom? If you work in a district where the procedures outlined in the readings are not in place, then you have an old school remediation program, slowing kids down rather than catching them up. So that's it for my RTI presentation. It was meant to augment your readings, not replace them.